back. Now I'm going to grab a lumbar spine. Downloading the lumbar spine. This is a 69-year-old male patient, and it says he has pain. So lower back pain, old age, male, all that good stuff we are used to see here. There is really nothing new. I just grabbed my template for old man's spine. There is a little tiny mild left-sided scoliosis. I guess this is a fracture. Seems like it. Seems like a fracture right there. Yes, this is acute. There is a partial collapse. This is 2, 3, 4, 5. No. This is a transitional vertebra right there. Is it L5 or S1? I'm quite sure this is D12. So this should be L1. So it's L1, L2, L3, L4, L5. So this is transitional S1. So we have to start from there. So the surgeon can guide himself all the way to the fractured vertebral body. There is no edema on the steer sequence. So this is a node fracture. It has healed already. So this is just a chronic collapse. Are there any signs of edema? No signs. No signs of edema, just chronic disease. This is probably due to trauma or osteoporosis. Arthrosis, facet joint, severe facet joint arthrosis, thickening of the yellow ligament. There is vertebral canal stenosis, mild, yet another site of stenosis, and of course the technician. Yes, technician did this on a T1. I don't know why. And this is, there is a T2 right there. T2. So I can say nothing. So it's all right. It's just there. We have a bunch of extrusions. We have 1, 2, and 3 extrusions from L2, L3 to L4, L5, and L5, S1, 3 extrusions, severe arthrosis, some vertebral canal stenosis, and an old age vertebral collapse. So let's see. Also, there is diffuse hypertrophy and fat substitution of the perivertebral muscles. Just this is chronic denervation and old age all together. So osteophytes. Let's describe the transitional vertebra. It's S1. It has a almost complete intervertebral disc and a bunch of anomalous joints between S1 and S2. I can say it's S1 because this is the last rib. So this is L1. 1, 2, 3, 4, and 5. So this is S1 and this is S2 as far as I can tell without a proper full spine scan that shows me C2. If I can see the second cervical vertebra, I can properly count from up to down and be sure of which segment this actually is. If I don't, I just look for the last rib and call the last rib D12. Since then, I can go counting from up to down until I figure out what this is. This is not 100% what I'm supposed to do, but it is 100% what I can do in this case, because this morphology clearly shows some kind of malformation, some kind of fusion, partial fusion, or failure of proper spine segmentation right there. So this is a hypoplastic facet joint right here. This is an anomalous joint right there with the processus transversalis, left processus transversalis or transverse process, and this is a smaller than normal, a hypoplastic intervertebral disc. So this is a transitional vertebra for sure. So S1 is transitional, and of course, as soon as the patient has some kind of complaint and has a transitional vertebra, it's quite common, almost certain, that he is going to have arthrosis at these sites. Excuse me, like that. That is arthrosis. So this is quite a painful transitional vertebra. So there is also an increased curvature right there. This lordosis is increased, which is also a sign of chronic degenerative disease. There is diffuse modic 1 and 2 changes on the vertebral plateaus. I can tell old fracture of L2. This is 3, 4 and 5. Não, eu tô gravando. Volto daqui 1 hora. So this is L2, L3. Okay. This is L4, L5 and L5, S1. So we have 3 extruded discs right there. And we have already stated there is some kind of vertebral canal stenosis there and there. Yes, mild vertebral canal stenosis. L3, L4, no, it's L4, L5 and L5 S1. The intervertebral foramina are fine. There is diffuse hypertrophy of perivertebral musculature. So let's just summarize it to make it easier for the referring physician to read. Extrusions right there. Osteoarthrosis of the facet joints is severe, and there is that vertebral canal stenosis right there. It's there, it's